All right, so we potentially have a horse here with a sore low back. I was called out to work on her. This is Zaria, and she's a 6-year-old Mustang. And I was called out to work on her because apparently she was taken out on a trail ride the other day, and she took a couple bad steps, did a little crow hopping. Excuse me. Did a little crow hopping. And so the owner just wants to make sure that she's not sore. I have worked on her in the past, and she had some soreness in her left SI joint that seemed to go away. But we're concerned that maybe she's got some SI joint soreness coming back. And this mare is also for sale, and her owner is awesome, and she just wants to make sure that nothing's going on, so she's able to pass along good information to potential buyers. So I'm just out here to evaluate her back. So the first thing I do when I evaluate a horse for a sore low back is, or just a sore back in general, is I just do a general scan with my hands. So usually I'll use my thumb and my middle finger. I'll put my big knuckles here right on top of the spine, right in the groove where the spinous processes are. And I'll just slide my hand all the way down her back, trying to keep equal amounts of pressure on my fingers and the heel of my hand, because that's where all the palpation is. I'm not palpating over the spinuses. I'm just palpating the muscles that run along the spinuses. And I'm just looking for anything major, any big signs of pain, such as dropping, muscle spasming, head coming up, ear pinning, tail swishing. But primarily what I'm trying to do is I'm just really using my hands like a listening device and seeing if any of the muscles react to my pressure. Good girl. And if they do react, where in the spine is it reacting? Is it on one side or both sides? Is it a small area? Is it a large area? And right now she's acting just fine. So if that scan of her back, that general scan, revealed any soreness or tightness or spasms or anything like that, then what I would do is I would just go into that area where she spasmed and just try to hone in on where that discomfort is coming from. Whoa. Whoa. And you can see with her that, you know, as I'm doing this, she's really not giving me any indication whatsoever that there's pain. I mean, if anything, she's enjoying it. Her head's dropping, her ears are flat, her face is nice and soft. There's a good girl. Her lips kind of quivering. So, you know, from that, I'm not really concerned. But whenever you've got crow hopping or bucking, anything like that, it's always a good idea just to check over the tops of the spinous processes here and make sure that there's no pain directly over the spinuses. And if, for those of you that don't know what a spinous process is, you basically have the vertebrae in the back, and generally speaking, in this area here in her mid to low back, the vertebrae are anywhere from 1 to 3 inches below the surface. In the withers, they can be 6 to 8 inches below the surface. I'm just talking about the bodies of the vertebrae, the vertebral bodies, which is the big, thick portion of the vertebrae. I'm not talking about the spinuses that stick up towards the surface, because obviously those are at the surface. But the vertebral bodies themselves are 1 to 3 inches below the surface up here. So what I want to do is I want to put pressure directly over the spinous processes to check and see if there's any pain or inflammation in the spinuses, which sometimes can indicate that there's pain and inflammation lower into the vertebrae, into the spine. She's not reacting at all. If she was reacting to this pressure up here, then to me that's an immediate referral to the veterinarian for an x-ray. And the reason for that is simply because there's not a whole lot of soft tissue directly over the spinous processes. You're basically looking at ligament, you know, obviously skin tissue, ligaments. There's a little bit of fat, but there's no muscles right on top of the dorsal spinuses. So if you have pain there, generally speaking, you're going to either have some calcification of the supraspinous ligaments that connect the spinous processes together running directly over the top of the back, or that indicates some arthritis in the bones themselves. So You know, people always use the term kissing spine, but kissing spine is just a form of degeneration. It's a form of arthritis. So you could have less significant forms of arthritis in the forms of calcification, some bone spurs, you know, little osteophytes, you know, something like that, where it's irritating them, but it's not to the point of kissing spine where, you know, something surgically or anything needs to be done. So there is no sensitivity to my palpation up here. So I'm not really concerned about her spine whatsoever. So I'm then going to go back to the SI joints. SI joints, SI is sacroiliac. So the SI joints are the sacroiliac joints, and that means that that joint is comprised of the sacrum and the ilium. And when your horse is moving, I got to show you guys what's going on here. We got a little buddy playing with my phone while I'm videotaping. Holy crap, that makes me sound old while I'm recording. So anyway, when the SI joints are functioning, what they're doing is they're flexing and extending the hind end. So let's say that my fist is the sacrum, right? That's right in the middle of the low back. It's part of the pelvis, and it connects the pelvis to the rest of the spine. So if this is the sacrum, this is my ilium, and they come together. This is the big flat bone of the pelvis, which has a ton of muscle attachments. The glute muscles sit up in here. All the extensor muscles of the pelvis attach to the rim of the ilium, so that when they contract, they pull the pelvis down and forward towards the head so that the horse can extend the hind legs. So we got sacrum and we got ilium. Now when your horse moves, this is the movement that's occurring at the sacrum and the ilium. A lot of people think it's just this, but in actuality, it's this. The sacrum is moving and the ilium is moving. So if you have an issue at the sacroiliac joint, it could be that the sacrum itself is not moving properly or the ilium is not moving properly. So as a chiropractor, I have to determine which one of those is the problem. So when the horse is moving, and let's say the horse is facing this way, the same way that I'm facing the camera, when the horse is moving and it wants to extend its hind leg backwards, maybe you can see my foot, if it wants to extend the hind leg, it has to drop the ilium down and forward because the leg attachment is down here, right? It's attaching at the hip. And so when I drop this down, the hip extends backwards and so does the hind leg. If I want to flex, right, I want to move forward, then the ilium has to move up and back because the leg, again, which is down here, is going to start to move forward at the hip. So now I'm bringing that leg forward. So it's always doing this. And when one side's doing this, let's say my left side's extending, the other side is flexing. They're always moving in opposite directions of each other. So if you have a horse that's constantly standing with one leg forward, or it's constantly resting the same leg, you know, something like that, maybe they're short striding on one side, that's because it's not moving, most likely it's not moving properly at the SI joints. So knowing how the SI joints move give you an indication of which SI joint could possibly be the problem, and at the very least, I can tell you the position of the SI joint based on the position of their legs. So hope that helps. A little bit of SI joint anatomy for you there. There's a little bit more to it, but generally speaking, that's how the SI joints move. There we go. Good girl. So I'm going to put a little bit of pressure onto the ilium. So I'm going to be driving the ilium side of the SI joint down and forward. So if you remember how I was just explaining that movement, when I drive that ilium right here down and forward, what I'm doing is I'm pushing the pelvis into a position that it would be in if that side were extending behind. So for her, I was just on her right side, so I'm pushing down on that ilium, which is the movement that the SI joint will make when that leg goes behind.